Live from Fox Studios, just you watch the best. Fox 10 News at 9.
Your knees hurt. We're talking not just occasionally, but all the time. Chronic pain. You've got a lot of company. Tens of millions of people who suffer from knee pain.
And it's not just the elderly with complaints. Tonight we take a look at a program in the Valley dedicated to getting rid of the pain in your knees without surgery. Linda Williams shows us how it works.
Not often considered the sexiest part of the body, it's seldom appreciated, barely even noticed until it hurts.
It's kind of like rubbing broken shards of glass together in there.
Eric Schrader, 31 years old, with knee pain. Joanne West just turned 60. Contributing to her knee problems are tendinitis and a torn cartilage.
It was very painful. I couldn't do anything. I was to the point of not being able to do anything.
Joanne says competitive clogging, that's dancing, no doubt led to her knee problems. As for Eric,
I played some sports and I was in a car accident and I'm a little overweight,
So, Eric and Joanne, like millions of Americans, have arthritis. Theirs is in their knees. Their knees are basically wearing out. Osteoarthritis has caused the cartilage and fluid that helps lubricate their knees to deteriorate.
When you start to fray away this, you can imagine it's not a nice smooth surface anymore, and so it becomes more bone on bone. It's not slippery and smooth anymore.
Weak lubricant plus a little cushion equals pain in the knee.
How's it feeling?
Okay.
Yet, Joanne and Eric are moving pretty well in their physical therapy sessions. This is all part of the knee surgery prevention program at Arrowhead Health Center. A week and a half ago, Joanne received her first injection of Hyalgan. It's aimed at boosting her cartilage cells. It's not this easy, but the idea is the same. Once a week for 5 weeks, Dr. Johnstone injects a fluid called Hyalgan into the knee. It's a natural substance made from, surprisingly, the comb of a rooster.
And you're injecting right into the space of the joint itself, right where the fluid is.
How does the doctor know that the medication is going exactly where he wants it on the knee? This machine helps. It's called a fluoroscope. It has a big camera on the end, and by looking at a screen, the doctor can see exactly where the medication is being placed. Dr. Johnstone says Hyalgan is a medication that gives patients who aren't ready or able to have knee replacement surgery, it gives them an option.
So having an option besides just, becoming more and more crippled, more and more pain, those kinds of things, to have that kind of option is just a wonderful thing to be able to offer to patients.
I'd rather have this than have to go through knee replacement in like 10 years.
Joanne is already sold on it, saying it has changed her life. She was using a cane and a walker. But after the first series of injections,
I got out and washed my car. I planted plants. I can bend my knees now. I wasn't able to squat at all, or if I did, I couldn't get up.
The doctor says Hyalgan works on about 70% of the people who try it, and it lasts about 6 months to a year. Then you can opt for more injections. A shot in the knee that could prove to be a real shot in the arm. Linda Williams, Fox 10 News.
The Arrowhead Health Center's knee surgery prevention program involves both the injections and the physical therapy program. People should not use Hyalgan if they are allergic to poultry. You'll recall a rooster comb is used in making Hyalgan.